What is sex therapy and what happens during a sex therapy session? Hi, my name is Martha. I'm a clinical sexologist with a doctorate in human sexuality, and I'm from Eros Coaching. I'm a sexologist. I consider myself more of a sex coach rather than a sex therapist. And there is a difference between a sex coach and a sex therapist. A sex therapist would usually be somebody who has a master's in psychology and then they minor in sex therapy and therefore can call themselves a sex therapist. A sexologist usually has training in human sexuality. They may have a master's in human sexuality or a doctorate in human sexuality. In my case, I have a doctorate in human sexuality. I also have certificates in counseling, coaching, and sex therapy. And so in my work, I bring together different parts of what I've learned so as to help my clients in the best way possible. I also have training in relationship coaching. I just needed to mention that. I'm also doing at the current moment my master's in counseling so that I have more skills to offer my clients that is more generic rather than sex-based. So in a sex therapy session or a sex coaching session, you first want to make sure before you even go in that you have understood what they're offering, what are their terms and conditions, and what are the things that they expect. For instance, during the time that you have, what are the things that they expect you to cover. If there are any forms that they would like you to fill up before the session and send it in to them, that will really save time because you are paying for the time that you're having with them. Also, in a sex therapy session or sex coaching session, what happens is they are investigating with you what are your sexual concerns. So you want to be clear in your head, what is it that is actually going on for you and how long has it been happening, what happened when it first started happening, how your partner feels about this situation, and basically all the details. So for instance, if you have sought out different kinds of help, for instance, a gynecologist, a urologist, maybe counseling, it's important to mention all these things and also how long you've done them and what you got out of them. So basically as much details as you can in that amount of time so that the person that you're working with will be able to get a good picture of what is going on and also what you have tried, because there's no point going into what you have tried and didn't work and then it's not really that relevant to you. So it's important to explore. For instance, if you have gone to a nutritionist, if you've gone to a personal training, personal fitness trainer, for instance, these are all important things to get a sense of where you are at physically, mentally, emotionally, whether you have practices, for instance, yoga or meditation, what are your beliefs when it comes to your spiritual or religious beliefs. So all these things, your background, your parents. So without going too much into story, all the facts, all the details, and it's a dialogue. So don't worry if you leave out things because your practitioner will be able to ask you those questions to fill in the gaps. So sometimes the information that we have and the way you describe the problem, they will have the experience to know what is it that you are saying, but it's not being said as well. So having been in practice for 7 years now, I not just hear what I get from my clients, I also sense what they're feeling. And from my experience and my training, I also am able to detect the deeper underlying issues that they're not really saying at times. So for instance, if someone has premature ejaculation, it's pretty much understood that if it's been going on for some time, it's causing them some distress, they would have some anxiety, and because of the anxiety, probably leading to a low sex drive. So these things are the things that are not really being spoken, which a trained practitioner will be able to pick up on. And so what happens is you describe the situation, they ask questions to get a better picture, and then they might, during that time, if there's time, give 1 or 2 suggestions of what you can do in the meantime so that you can get better. And if you come back for another session, like a future further sessions, then they might actually ask you how you are doing, if anything new came up. And if they had given you a little homework assignment to do, then how is the progress and new details, new developments that you want to share. So from there, they will be able to come up with more things that are tailored to your needs. Sometimes sex therapists might come out with a treatment plan, and this has to do with, first of all, being able to get a good picture of what is going on before giving you that treatment. And it's very important to understand that you're not going to see big changes in 1 or 2 sessions, although a lot of my clients who come to see me expect to have big shifts in a short amount of time, because a lot of them don't really know what's coaching in the first place, and then they are in high states of distress, so they just want something to feel better. And it's kind of like saying when you need open heart surgery, but you actually just use a plaster to feel better. And unfortunately, this is the client's prerogative. I can spend time educating them about the process and what is needed, but a lot of people actually don't have the time, money, or patience to actually stick through the process, so that it's not just a quick fix, so that it's not just feel better, but actually get completely well. And when it comes to a psychological state, these are intangibles. You can't really see it. People can't really fully understand the full extent of the value sex therapy or coaching does. So I hope this little video gives you an insight of what you can better expect in a session. And also, I have other videos on the difference between different types of helping professionals that you may want to look at. So I've produced many videos over the years. And if you have questions, you can just drop me an email, and I will do my best to answer. And also have so many few videos, I might be able to refer you to something that's very specific to what exactly you are looking for, without you feeling that you must have a private coaching session. This is not what it's about. This is about me wanting to help as many people as I can, and that's why I'm putting out all these free videos. So if you have questions, drop me an email, and you can email me at ask@eroscoaching.com. You can also post a comment below, and I look forward to hearing from you. This is Martha of Eros Coaching. I'm a sexologist, not a sex therapist. I can't speak for sex therapists. I do understand a lot about what's the process and the difference. So if you have questions, contact me.